Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Dixon's Chemist, who are the experts in LDN and associated treatments in the UK. Dixon's Chemist are the most cost-effective for LDN in all forms within the UK and Europe, maintaining safety standards far in excess of what is required. Why would you choose to get your LDN from anywhere else? Call 0141 404 6545 today to speak to their LDN experts. I'd like to introduce my guest today, Dr. Eduardo Beltran. Thank you for joining us today, Eduardo.
Thank you very much, Linda. I'm very pleased and honored to be on your radio show today.
Well, let's find out more about you, because you were saying that you operate not only in the US but in Brazil. Could you tell us a bit more about your practice or practices?
Yes, we have an institute in Brazil, in the capital city in Brasilia, which is known as the Instituto de São Patrício, which would be the St. Patrick Institute. And we offer different courses to physicians, nurses, dentists in the area of integrative medicine. So we basically train a lot of healthcare professionals and put them up to date with new treatments that are available out there. On behalf, where we even have a specific class on LDN, which is an excellent a subject to talk in and to get into. People are very interested, and once they find out that you have wonderful and excellent outcomes with patients, we start seeing these physicians and healthcare providers starting to prescribe LDN.
Mm-hmm. And what conditions would you say you're mainly teaching about?
Well, LDN is a very big, important aspect of our courses that we offer over there, and also the treatment that we offer for free for all of our patients in Brazil at the St. Patrick Institute. But we also have other areas which are very important, such as the prescription of alpha lipoic acid, which is very useful when you combine it with LDN. And we have seen beautiful results with a lot of patients, getting better, not only with autoimmune diseases, but even cancer. And that's one of the main reasons why a lot of, physicians want to do our courses with us, because it's just one of those things that you usually don't see on your day-to-day practice.
Mm-hmm. So you're saying cancer. Are you doing autoimmune conditions and chronic pain as well?
Well, as you might know, LDN is a wonder drug. I mean, you can treat a whole bunch of things with it,
Mm-hmm.
But yes, mainly things that we usually get, our patients who have chronic conditions, fibromyalgia, rheumatoid arthritis, psoriasis. I am a dermatologist, and that's one of the fields that I've gotten into, mainly in treating a lot of patients with psoriasis and having beautiful results with that. And but yes, it's mainly autoimmune diseases and cancer in general.
If we can just deviate from what we were going to talk about for a moment, we have a lot of patients with autoimmune conditions that affect the skin, such as Hailey-Hailey's disease, Brecht's syndrome, Vitiligo. have you treated any patients with those dermatological conditions with LDN?
We have had some patients who came into our clinic and they had vitiligo. We haven't had the opportunity of treating patients with those other two,
Okay.
but yes, we have seen patients who have actually come into our clinic, and I mean, we found out on behalf of other patients. But that's basically usually how patients end up getting referred to our clinic, at our institute in Brasilia. And the interesting thing is, right, about 30% of these patients who do have vitiligo also have a thyroid condition. So we have noticed that their thyroid condition all of a sudden starts getting better, and despite the fact that we haven't actually really been able to see a repigmentation of the skin on the patients that have vitiligo, but we were able to see that the disease or the condition itself stopped at a specific state of the disease.
Mm-hmm.
So I think that's an improvement right there. Just making sure that you don't have the disease progress. Speaks a lot for itself.
And have patients had improvement where their skin has gone back to the correct colour?
Well, like I said, repigmentation, unfortunately, up to now, we have not actually seen patients have repigmentation of the skin, at least with the clinical cases that we have seen at the Institute. But like I said, 30% of the patients who do have vitiligo have some certain kind of thyroid disease. So we have noticed that this 30% of patients actually got better from their thyroid disease. So that's something that was taken into consideration, and we thought that was very interesting that we saw in our patients.
I've seen some pictures from a lady whose pigmentation, she had these large patches, and over time they gradually filled in so that they weren't noticeable. So that was really interesting. So hopefully your patients will too.
Hopefully in the future, I think it's just a matter of time, because don't forget, patients do come sometimes to the clinic and they don't have a continuous follow-up as they should. So, and you have to take into consideration other factors as well, that some patients take the medication continuously, and some may take it intermittently. So there are a lot of things that have to be taken in consideration.
Yes.
So that's something that just sometimes is a little bit out of our control,
And I have found with the patients I know who use LDN for psoriasis, some have had amazing results, but it seems to take longer for those people to have the good results. It's not like if I pressed people who have treated patients with psoriasis, they're saying around the 6-month mark. I mean, how long would you say it's been before you've noticed a difference in patients?
Well, I have a very interesting story I think I would like to share with you. When I studied dermatology, that's one of my specialties. I did internal medicine and dermatology in Brazil. And when I was in my second year of dermatology, I was introduced to a physician by the name of Dr. Laís Ribeiro, and he was the one who actually introduced LDN to me. So Dr. Laís Ribeiro is a very well-known, very well-renowned physician in Brazil, and he has published more than 148 articles, and he's just very well-renowned worldwide, Dr. Laís Ribeiro. And he's a cardiologist and also a nephrologist. So that's something that's very interesting. And one of the things that I noticed, as soon as I started my first year, right after residency, I started prescribing LDN to patients who had psoriasis. And I saw remarkable, really great results with patients who had psoriasis. And in 2016, I remember attending a patient. This was a 38-year-old woman who had a very, very bad case of erythrodermic psoriasis, which is it's the worst type of psoriasis a patient can actually have. It's basically all of her body was, full of lesions, and she had a very bad case of erythrodermic psoriasis, and she had already consulted with 3 other dermatologists. She was on methotrexate, she was taking steroids, and she wasn't getting better at all. Her blood work came back as pancytopenia. I mean, she had anemia, leukopenia. Her platelets were low. I mean, she was in very bad shape. So she said, you know what, Dr. Beltran, when she consulted with me in I think it was in June of 2016, she did not want to take any other type of cytotoxic drug or anything similar to it as methotrexate. And I offered her the option of trying something new, which was LDN. Let me just make the picture a little bit better. In dermatology, we use a classification scale known as the PASI score. I don't know if you're familiar with that.
No.
The PASI score is a scale that we use in dermatology to be able to grade the severity of the patient's psoriasis. This patient had a PASI score, if I don't forget, I think it was around 48. Being the maximum being 72 is the worst type of condition you can ever get, and 0 would be the absence of the disease. So she had a PASI score of 48, which was very bad. It's pretty bad, She had edema, swelling. You could not recognize her. You would look at her face and you would just see a patient that was in a lot of pain. She had a lot of joint pain, a lot of facial edema, upper extremity edema, lower extremity edema, and all over her body just basically covered with, plaques and lesions. And the main characteristic was that she had a wet type of edema, which is even worse. That tells you that there has been a compromising the vasculature of the blood vessels, and that's something that's very severe. So when a physician sees this, he says, "Oh my God, this is not good. We have to really take good care of this patient." So immediately we took her off all those medications that she was taking, and we started off with 4.5 milligrams of LDN at night. And in the first 10 days, we just noticed that she started getting better. And the swelling started to reduce, and by the 20th day, 50% of the swelling and the lesions that she had in her body were completely gone. Not completely, but but 50% of the lesions were gone. And when we reached the 3rd month of treatment, basically she was lesions free. So she went into a remission, and that was just something incredible in such a short time period. For someone who had a very bad case of erythrodermic psoriasis, to be lesion free is something incredible. One of the things I would like to mention here is that not only did she take low dose naltrexone, but also was necessary doing a modification on her diet. So we noticed that patients who have psoriasis sometimes have a issue with gluten. So there is a connection between gluten and psoriasis here, and that's maybe why her improvement was so noticeable.
Right. And is she still in remission?
Yes. This patient, I'm always checking up back on her. She has my personal email, and she calls me once. I even call her just to make sure that she's doing okay. Actually, I do that with all my patients, almost all of them, especially the ones that have had very bad cases. And she is very good. She is doing fine. She is happy. She has had such a profound impact on her life. Her quality of life has changed so much. And that's what, brings all the joy and pleasure, of being able to help people.
Yes. And tell us a bit more about the clinic in Brazil where people don't have to pay. So if there's anybody out there in Brazil who has an autoimmune disease, cancer, and they would like to
Yeah.
consult, how do they go about doing that?
Yes. We have our website. It's the Instituto São Patrício. You can also check it out at www.stpatrickinstitute.com. Within our website we have another page where you can get to see a little bit of the Instituto São Patrício, and there you can get in contact directly through us through email, or you can even give us a call. And usually people call us directly to the clinic, and we schedule them up for consultations, and obviously some other physicians that already work in different clinics sometimes even might refer them to our clinic.
Mm-hmm.
So we work with a great number of physicians from the region, and we even have had patients who have come from very far away, from like 3 different states away from to Brasilia. And I mean, these are patients who are very poor, do not have access to health care sometimes. And if they do have access to health care in the rural community, some of these physicians will end up, referring these patients to us. And it's incredible. I mean, if you look at, for instance, I remember seeing a patient who had multiple sclerosis. The treatment for multiple sclerosis is absurd. I mean, just the price that you pay for it in Brazil, yearly you would be paying around more than 60,000 reals for the whole year. I mean, that's just unrealistic for a person who lives in the rural region of Brazil.
Mm-hmm.
And if you were to treat them with low dose naltrexone, it would cost around 250 reals, which is very affordable.
Mm-hmm.
So, yes, of course. I mean, a lot of people are referred through other patients and other physicians as well to our clinic. We are always open to being able to help the general population, and but mainly it's the mission that we have at St. Patrick Institute is to be able to get the word out.
Mm-hmm.
and make physicians more aware of the potentials that LDN has for treating a whole bunch. I would say you could probably treat all types of autoimmune diseases
Mm-hmm.
without exception. And when I say that firmly, with no hesitation, because I am a believer myself. I've seen so many results with LDN, and obviously with other medications as well,
Mm-hmm.
such as alpha lipoic acid. And I mean, that's just part of what integrative medicine is all about.
And what about your practice in the US? Is that in Ohio?
Yes, in the United States, I am a clinical researcher at the St. Patrick Institute. We offer courses to physicians, nurses, people from all over different areas of the area of allied health, I guess you could say. And we've had people also from different countries come to St. Patrick and, do a course on integrative medicine. And we have actually one of the modules that we offer in our course of integrative medicine is a module exclusively on LDN. So people who come to St. Patrick here in Columbus, Ohio, are usually coming with the intention of getting, more information and more professional enhancement on the subject, on the area.
Well, that's amazing. How many doctors would you hazard a guess at that you've trained if you add the ones in the US to the ones in Brazil?
Oh, well, we have a limited amount of vacancies here in the U.S. We only accept up to 15 professionals, healthcare professionals. Let me restate this. I mean, we don't only just train physicians, but we also have dentists and nurses. and people from different backgrounds as well.
Mm-hmm.
Because I think it should not. LDN should not be just limited just to the physicians.
Mm-hmm.
I think it should be, you know, I think the information should be available to all healthcare providers, because doctors don't only work by themselves. They have to work with a team.
Mm-hmm.
And if you want to have good outcomes with your patient, you have to be a team player. So it is important that this information, gets well distributed around all types of healthcare providers.
Mm-hmm.
So, now coming back to your question, we have had people from all over the world, and we had people from Mexico, from the Caribbean, St. Martin, Bahamas, Brazil, Argentina. We even had some people coming from Spain and from Portugal to get the course, and have that enhancement. And in Brazil, obviously, we have so many Brazilian physicians and also nurses that do get the training with us that I've practically lost track, but I'm more than certain we've trained more than 500 so far. So it's been
Wow.
it's been a journey.
Mm-hmm.
Yeah.
That's really interesting. So how do people get hold of you? How's the best way of reaching you?
Usually people get in contact with me through the website,
Mm-hmm.
through the email. They can contact me through the following email, which is stpatrickinstitute@gmx.com. Or if you would like to get in contact directly to my personal phone number, is 614. That's the area code here in the U.S. 717-5916. And obviously they can look at our website, and they can fill in the contact us form as well.
Mm-hmm.
So that's one of the three ways you can get in contact with me and with other physicians as well.
Mm-hmm. So if you only train 15 prescribers at a time, whether it be a dentist or a nurse prescriber or a doctor,
Mm-hmm.
how long a waiting list do you have? How easy is it to get on one of your courses?
Well, we have we offer the course 3 times a year. Actually, we're going to be giving one pretty soon in July. So we already have all the vacancies filled up. And a lot of people, when they call, sometimes all the vacancies are taken up. It's because the reason why we only offer it to 15 professionals, healthcare professionals, is because we want to make sure that the information that's given out is given in a certain way that it's more individualized. It's not just a certificate of participation that they receive, but they also receive a hands-on training on being able to know how to really prescribe and understand the labs that come along with this. Because obviously, I don't want to get into much of the details, because it's a little bit too in depth if I start talking about this. But a lot of the labs that we as physicians use, sometimes we don't use those labs in the best way as possible. We usually just look at the normal ranges, right?
Mm-hmm.
Usually, when you want to have a patient, in the upper normal ranges, that's one of the goals that we're going to have as a physician. Try to maintain our patients at the upper normal limits. Or if it's best off having them at the lower normal limits, we're also going to go ahead and range there. Let's not forget that every patient is an individual, and you have to treat patients as individuals. No one is exactly the same. So that's why sometimes you even need to modify the dose of LDN, because sometimes you might prescribe it at 4.5 milligrams, and you won't be getting the effects that you will be actually expecting from the patient. And sometimes it's necessary to even go a little bit lower. We might be prescribing it at 3 milligrams, or maybe even a little bit less. So, like I said, this is a very individualized, tailored course, and if we were to teach it to too many patients, too many healthcare professionals, it would lose a little bit of that individuality of being able to make the course more tailored for yourself.
Mm-hmm. And how long is the course?
Course takes about 7 days. Sometimes it might be a little bit more, depending on how well the course, how well the students evolve through the course. But usually, yes, it's a 7-module course. It's 7 days. It would be a week.
Mm-hmm.
Mm-hmm.
Very interesting.
I mean, we have had a lot of people from Mexico. A lot of Mexicans come in and take the course with us, and when they come back, I've had feedback from these doctors in Mexico that are working in Mexico, telling us that they already have started seeing results, and some of them are even publishing in certain scientific journals their clinical cases, which is something that is very gratifying. I think the main reason why LDN isn't so well known, it's not as well known throughout all the medical staff, is because the way they teach us medicine in medical school is basically what Big Pharma wants us to know.
Mm-hmm.
That's basically what it is. This is such a wonder drug that does so many good things for us. I mean, for the patients as well. And it's unfortunate that that this information is not taught in medical schools. It should be.
Mm-hmm.
And that's one of my missions. I think that when I got convinced of the benefits of LDN, I started carrying the flag and say, okay, this works. You can actually have an impact on people, and this needs to get out. The word needs to get out.
They do
so
actually.
This is the main reason.
Sorry, they do actually teach LDN in the medical school at the Naturopathic College of Medicine in Portland, in Oregon.
Oh yes, but not allopathic universities.
No, exactly.
See, that's what I mean. 70%, or I would say even more. I would say 80% of all medical schools are allopathic here in the United States,
yes.
and so I mean the majority of these doctors who are actually graduating probably didn't even hear about LDN when they were in medical school.
Exactly. Or about nutrition.
Exactly, about nutrition, especially nutrition. We have actually we don't even have a course specifically on nutrition. And if we do, it's probably going to be just about like a 2-day or 3-day course, and that's it.
Yes. Well, we've come to the end. I'm sure we could have carried on talking for hours. It was really interesting listening to you, and it was just amazing learning all the different things you do, and it's so good that you're helping the people in Brazil. I mean, we need people who are genuinely trying to help people.
Yes. I mean, thank you, Linda, for the opportunity of being able to be on your radio show and give a little bit of my experience, a little bit of my insight on how LDN's being promoted in Brazil, and not only in Brazil, but I mean worldwide. I think the word has to get out there. Physicians need to start, being more aware that LDN is a wonder drug. It really is. It does so many beautiful things for patients, and it's just one of those things that needs to get out. I considered LDN. I know it was released back in the 1980s. For the first time, it was approved through the FDA back in the 1980s, and I would consider LDN to be the best or the most important discovery in the 20th century. So it's really important that people get to know a little bit more of LDN.
Mm-hmm. Well, thank you, and we'll have you back another time.
Well, thank you very much, Linda, and I hope to speak to you in the future.
This show is sponsored by Dixon's Chemist, who are the experts in LDN and associated treatments in the UK. Dixon's Chemist are the most cost-effective for LDN in all forms within the UK and Europe, maintaining safety standards far in excess of what is required. Why would you choose to get your LDN from anywhere else? Call 0141 404 6545 today to speak to their LDN experts. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.